Welcome to the Emmanuel Osemota Foundation and Block series. Today we will be discussing a syndrome that is very common among girls. Polycystic Ovarian syndrome is a heterogeneous genetic disorder that mostly affects young girls of fertile age. Polycystic ovaries contain multiple fluid-filled cysts. In PCOS, excess androgen hormones are produced. Androgens are predominantly present in males and less frequently in females. Multiple cysts in the ovary, almost 10 to 12 in number, are present unilaterally or bilaterally. These cysts are the characteristic feature of PCOS. Egg formation is an important cycle occurring in the ovaries. Luteinizing hormone, LH, and follicle-stimulating hormone, FSH, are concerned with the genesis of follicles and ovum. Hypersecretion of androgens, male hormones, affects the formation of FSH and LH, resulting in irregular periods and multiple immature eggs formations. These immature eggs get converted into cysts. Onset. PCOS most commonly occurs after menarche and before menopause, during 14 to 48 years of age. Statistics. According to advanced research and statistics, 19% of young females cannot conceive or stay pregnant due to polycystic ovarian syndrome. These statistics indicate the importance of early detection and treatment of PCOS in adult and fertile women. Factors associated with PCOS: genetic factors, environmental factors, and lifestyle. What is the difference between PCOS and PCOD? Polycystic ovarian disease, PCOD, is somewhat less severe than PCOS. PCOS is concerned with anovulation, but PCOD does not cause anovulation. PCOS affects fertility and makes women hard to conceive, but women with PCOD can ovulate and retain fertility. What are the types of PCOS? PCOS is associated with different factors like inflammation, insulin, stress, and different pills. There are mainly 4 types of PCOS: PCOS associated with inflammation, PCOS associated with insulin resistance, most common, hormone-associated PCOS, mainly in stress, PCOS associated with pills. What does PCOS do to your body? PCOS has multiple physical and metabolic effects on your body. Hypersecretion of androgen can cause disturbed metabolism. PCOS can affect your metabolism and is associated with abnormal lipid metabolism that causes an increase in blood cholesterol level, LDL, hypertension, increase in blood sugar level due to insulin-resistant response. These pathological factors can lead to atherosclerosis, vascular thromboembolism, type 2 diabetes, ischemia, and stroke. What are the signs and symptoms of PCOS? PCOS can be asymptomatic and symptomatic. PCOS usually presents with hypersecretion of androgens, decreased libido, sexual desire, hair growth, hirsutism with the predominant male patterns in baldness, acne, depression, stress, obesity, cosmetic disfigurement, acanthosis symptoms, irregular menstrual periods, heavy menstrual bleeding, lower abdominal pain, pelvic area, enlargement of ovaries. When to see your doctor? It is mandatory to call your doctor for an appointment if you have the following symptoms: skipped menstrual periods in the absence of pregnancy, abnormal hair growth on your body, symptoms associated with diabetes, unable to conceive. How to diagnose PCOS? PCOS is diagnosed physically, biochemically, ultrasonography. Physically, PCOS is diagnosed by examination of the pelvic area to rule out an abnormality or mass. Biochemically, it is interpreted by the presence of excess androgen in blood. Ultrasonography shows an enlargement of both ovaries with multiple 10 to 12 immature small follicles in them. How to treat PCOS? Treatment of PCOS includes lifestyle changes, medical as well as surgical treatment. Lifestyle modifications. Lifestyle modifications include diet control, healthy food, avoidance of stress, and exercise. It includes a diet with low cholesterol and insulin administration to overcome diabetes and heart-related disorders, mainly in people with diabetes. Medication-based treatment. To overcome androgen level, pills and androgen blockers are the drug of choice to lower androgen levels in your body and normalize the ovulation process. For example, progesterone and estrogen-containing pills, for example, progestin. Androgen blockers are used to overcome the secretion of androgen and androgen-associated hirsutism. Induction of ovulation. Clomiphene is the drug of choice to treat anovulation. Metformin is the drug of choice used in type 2 diabetes. Surgical treatment. Surgical treatment of PCOS is indicated in patients resistant to medical treatment. Ovarian drilling is done through a laparoscopic approach. It destroys ovarian stroma that produces excessive androgens. What are the complications of PCOS if left untreated? PCOS should be treated as early as it is diagnosed. Otherwise, it can lead to serious long and short-term health effects on your body, including infertility, endometrial carcinoma, hypertension or high blood pressure induced by pregnancy, eclampsia and preeclampsia, fatty liver disease, psychological impairment. Conclusion: Polycystic ovarian syndrome, PCOS, is a disorder of young girls during childbearing age. It is caused by high androgen levels associated with multiple cysts in ovaries, resulting in anovulation. It affects various organs in your body, like the heart, liver, brain, ovaries, skin, etc. It should be treated as early as possible to avoid complications and risk factors associated with this syndrome. Written by Emmanuel Osemota. Thank you for listening. Until the next one.